the World Diabetes Day. Every year, 14th November is observed as World Diabetes Day to spread awareness about this disease since the year 1991. 14th November was chosen as the World Diabetes Day to commemorate the birthday of Sir Frederick Banting, who along with Christopher discovered the insulin 100 years back in the year 1922. As you all know, insulin is a very important treatment modality for patients with diabetes, especially those with type 1 diabetes. The World Diabetes Day is the largest global campaign to spread awareness about diabetes, reaching out to 1 billion people across 160 countries. So today we are all very fortunate. We are part of that big event of World Diabetes Day from India. So what is the theme for World Diabetes Day in the year 2022? The theme for World Diabetes Day this year is Educate to Protect Tomorrow. It's a very appropriate theme because the major management of diabetes is through self-care, especially type 2 diabetes. So, having said that, let us also have a look at the other aspect of this disease and this special day. If you look around, we have blue color today. So what is the blue color on this special day? Blue is the color of World Diabetes Day. Blue is the color of sky. It is the color of unity which unites all nations. Blue is the color of the United Nations flag. Hence the blue color for World Diabetes Day. If you see the blue circles here, they denote the unity among the different communities and people suffering from diabetes against this pandemic. Hence, blue circle is a symbol of diabetes globally. So the question arises that why is diabetes such an important disease? What is the red flag? Why so much noise about diabetes? Because as many of you know, diabetes may not present even with symptoms, and some people may have very mild symptoms. So why is diabetes important? Diabetes is important because it is preventable, and today we can proudly say it is a treatable disease. Because lack of symptoms or mild symptoms can often create a false sense of complacency, creating complications due to neglect of the disease. Heart disease, diabetes, kidney disease, blindness, neuropathy, amputation are some of the dreaded complications of this disease. Incidentally, diabetes is the leading cause of painless blindness world over, and diabetes is also the leading cause of non-traumatic amputation. So what are the different kinds of diabetes? Type 1 diabetes accounts for about less than 5% of the disease. Type 2 diabetes, which is mostly lifestyle related, accounts for 90 to 95% of the disease. So, having known that kind of diabetes, so what are the symptoms with which a person can present and which should stimulate us to have a high index of suspicion to diagnose these patients early to prevent complications? The symptoms are increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling sensation in the hands or feet, swelling over feet, unexplained weight loss. These should all stimulate us to think that there may be a presence of diabetes in a particular case, and we should try and diagnose it at the earliest. Type 1 diabetic patient often presents early. The symptoms may arise within weeks of onset of the illness. On the other hand, type 2 diabetes is quite insidious and the symptoms may arise gradually over few years. In some cases, the symptoms may be very mild, and in some cases, there may not at all be any symptom. Often, type 2 diabetes gets diagnosed for the first time when there is a diabetes related complication like blurring of vision or a heart disease. So, hence, one must keep a very high index of suspicion for diagnosis of diabetes. How is diabetes diagnosed? Diagnosis of diabetes is pretty simple. It is just diagnosed by estimating blood sugar levels, which is a very simple test and is rampantly available these days. A fasting sugar of less than 99 milligram per deciliter is normal. A sugar of 100 to 125 milligram per deciliter suggests pre-diabetes, and a sugar of more than equal to 126 milligram per deciliter suggests diabetes. Pre-diabetes is a stage before diabetes which, if not treated properly, can result in a full-blown disease. So hence it provides us with a window of opportunity to treat these patients early and prevent the full-blown disease from happening. So how is diabetes managed? We have learned about this World Diabetes Day, the significance of World Diabetes Day, why it is important to treat diabetes, what are the different kinds of diabetes, how is diabetes diagnosed, what are the symptoms of diabetes, and I think before that we also must dwell upon the fact that what actually causes diabetes, what is the cause of diabetes. Diabetes actually results from a mismatch between the production and the demand of insulin, which leads to uncontrolled blood sugar levels and the complications, some of which we just discussed. Type 1 diabetes is an autoimmune disease resulting from immune-mediated destruction of the insulin-producing beta cells in the pancreas. Type 2 diabetes is a little more different kind of disease as compared to type 1 diabetes. It is determined by genetic factors, risk factors and environmental factors, which all combine to produce this disease. It's important to know these risk factors, especially for type 2 diabetes, so that we can work on this to prevent the disease from happening and for controlling it in a good manner. So now coming to the management of diabetes. Type 1 diabetes requires insulin for its management. Type 2 diabetes can be managed to a large extent by lifestyle measures. Later in the program today, Dr. Vijeta is going to talk to you about lifestyle management of diabetes. She has professional certifications from Harvard Medical School and the World Obesity Federation UK. And we will also try and take up your questions at the end of the session. So, having learned that type 2 diabetes and type 1 diabetes are distinct diseases, distinct in their etiology and distinct in the manner in which, let's proceed further and see that 90% of the care in type 2 diabetes especially is self-care. So a lot of us think that we have a disease, we need to take the medicine and we'll be fine. But type 2 diabetes is not like this. It requires more than 90% self-care from the person who's suffering from this disease. The sooner we realize this, the better it is going to be, and the better our disease is going to be managed, and the less chances of complications that are likely to happen with an uncontrolled, neglected disease. So, to give you examples from real life, let's have a look around that what kind of people got diabetes and what did they do with it. If we look at the global community, we have actors, celebrities, authors, athletes who had this disease and who altered their lifestyle in major ways by controlling their diet, by going for fitness, exercise and having a systemic approach, a disciplined approach to life which help them to combat diabetes. I will name just a few of these celebrities to give you confidence that diabetes is manageable and it is possible to win over this disease. Nick Jonas, who is married to Priyanka Chopra, has type 1 diabetes. Tom Hanks, Halle Berry, Larry King, these are all awesome people who have done great things in their professional lives, who have diabetes despite having diabetes, and are very good examples and heroes how we can take inspiration from these people. Politician Theresa May, then author H.G. Wells also suffer from diabetes. Closer to home in India, we have Sonam Kapoor who has diabetes, Nasiruddin Shah, Kamal Hassan, Arvind Kejriwal, Nitin Gadkari. These are people with diabetes who are doing great things in their professional lives. So we can all draw inspiration from these people to know that diabetes is treatable and we can live a healthy and productive life despite having this condition. So what can we do really? I've been harping on the fact that prevention of the disease and preventing complications by good control. What can we do and how can we here from Healing Touch City Clinic help you in your journey towards this? So we have a very nice YouTube channel with my name, Dr. Ashit Syngle. This channel contains several videos for your self-help, which will give you a lot of tips on exercise, understanding diabetes, the lifestyle you can do, and managing your plate, how to create your plate, which is the diet, for managing your day-to-day life. The second is, at the end of today's program, Diksha is going to be going around with a QR code. This, if you scan this code, or people who cannot scan it, there is a toll-free number on that card, and you can dial this number. You will get help regarding diet, exercise, and awareness about diabetes. So that's a second very important resource. The third thing which I want to share with you is that there have been now paradigm changes in the management of diabetes by employing technology, and there has been a very new development which is FDA approved and which is also approved by the American Diabetic Association, and that is the twin technology. Today it is possible to create our metabolic twin online on cloud, and this twin, after an initial training of about 40 days, will metabolically behave like the person whose twin has been created. So those of you who are more interested in knowing about the twin technology and how the twin works in practical life, we have Mr. Harsh today here with us. You can all meet him at the end of the program and ask your doubts and take further information on the twin technology, which can especially help you to manage your disease in a very scientific manner. So with this, I am now going to invite Dr. Vijeta to talk to us about lifestyle in type 2 diabetes. Dr. Vijeta, please.